Can exposure therapy lead to profound recovery from severe PTSD? Imagine facing your deepest fears in a safe and controlled way. That's what exposure therapy aims to do for people with post-traumatic stress disorder. It is a well-established treatment that involves gradually confronting trauma-related memories, feelings, and situations. The goal is to help reduce fear and avoidance behaviors that often keep PTSD symptoms alive. Prolonged exposure therapy, a specific form of exposure therapy, has been extensively studied and shown to be highly effective. Research indicates that about half of the people who begin this therapy no longer meet the criteria for PTSD after completing it. When patients stick with the full course, the success rate rises to around 2/3. Long-term follow-up studies also show that many individuals maintain their improvements years after treatment, with some remaining free of PTSD even 6 years later. These findings have led major health organizations to recommend exposure therapy as a first-line treatment for PTSD. However, it's important to remember that not everyone responds the same way. Some individuals may still meet the criteria for PTSD even after therapy, and others might find the process initially distressing. Because of this, dropout rates can be relatively high, especially if the therapy feels overwhelming at first. That's why many clinicians combine exposure therapy with other approaches, such as cognitive therapy, which helps change negative beliefs about oneself or the world, or skills training to manage stress better. Virtual reality technology is also emerging as a helpful tool, allowing patients to re-experience trauma-related environments in a controlled setting. While exposure therapy can lead to significant recovery, it is not a quick fix. It requires patience, commitment, and professional guidance. For some, it may be the key to reclaiming their lives from trauma. For others, a personalized approach that includes different therapies might be more suitable. The important thing is that treatment plans are tailored to each individual's needs, and ongoing support is essential. In summary, exposure therapy has a strong scientific backing and can lead to profound recovery from severe PTSD for many people. It helps patients confront and process traumatic memories safely, which can reduce symptoms dramatically. But because every person's experience with trauma and recovery is unique, working closely with healthcare professionals to develop a personalized plan is the best way forward. If you or someone you know is considering this type of therapy, it's always best to consult with a qualified mental health professional to explore the options that suit individual needs and circumstances.